Hi, my name is Dr. David, neurosurgeon specialized in pain management. Today's topic is two joints, acromioclavicular joint and glenohumeral joint problem. First, let's talk about acromioclavicular joint, which is called AC joint. The AC joint is a common cause of shoulder joint, but it is often overlooked in diagnosis. The shoulder is made up of 5 joints. The glenohumeral joint, where the scapula and the humeral head meet, the acromioclavicular joint, where the acromion of scapula and the outer end of clavicle meet, the sternoclavicular joint, where the medial side of the clavicle and the sternum meet, and so on. Among them, the acromioclavicular joint has a fibrocartilaginous intraarticular disc that corrects the balance of the acromioclavicular joint depending on the state of acromion and clavicle while movement. In addition to degenerative arthritis, common causes of pain in the acromioclavicular joint include trauma, infection, and inflammation. Repetitive motions such as lifting objects, raising arms overhead, and throwing a ball can also lead to joint inflammation. The asymmetry or hypertrophy of the acromioclavicular joint can be observed, and pain can be confirmed by directly stimulating the acromioclavicular joint. In the passive arm elevation test, pain may occur in the higher position than the pain caused by rotator cuff impingement. A cross-body adduction test is commonly used to diagnose acromioclavicular joint arthritis. The cross-body adduction test is a test that applies the maximum stress to the acromioclavicular joint by manually adducting the patient's arm in a 90-degree flex state. It is very important to reduce repetitive overhead movements, adjust improper shoulder exercises, and avoid exercise that put tension on the acromioclavicular joint, such as push-ups, dips, flies, and bench press. Intraarticular steroid injection is effective in reducing pain and inflammation and improve pain and movement in about 90% of patients receiving injection. However, to minimize side effects of steroid, injection should be given at intervals of 3 months, and shoulder exercise should be restricted for 1 week after the injection. Now, let's talk about glenohumeral joint shoulder osteoarthritis. Patients over 70 years old who complain of persistent shoulder pain and have limitation in joint movement should suspect degenerative arthritis of the glenohumeral joint. Non-surgical treatments to reduce pain and improve joint range of motion have a good prognosis. The incidence is high in patients over 65 years old, and the prevalence is 20% in the population over 65 years old. Cartilage loss typically starts in the joint and posterior part of glenoid, and osteophytes form on the anatomical neck of the humeral head. The osteophytes formed on the glenoid and the humeral head restrict the rotation of shoulder joint. Pain occurs during actions such as raising the arm above the head or turning it behind the back, and is often described as third pain in the back of the shoulder. As the disease progresses, night pain occurs and affects sleep. The restriction of external rotation is the most severe, followed by restriction of glenohumeral head abduction, and the restriction of passive internal rotation is the least severe. In the diagnosis of degenerative arthritis of the shoulder, imaging is very important. In the X-ray image, joint space narrowing, osteophytes, subcondylar bone sclerosis, cysts may be seen. Also, wear on the posterior part of the glenoid can also be observed on X-ray. Injecting triamcinolone mixed with lidocaine in the subacromial bursa can be effective in treating degenerative arthritis, as subacromial bursitis usually come along with glenohumeral arthritis. If non-surgical treatment fails, the most effective surgical treatment for shoulder-degenerative arthritis is known as joint arthroplasty. Today, I told you about two main arthritis in acromioclavicular joint and glenohumeral joint. If you have any questions about this video, please write a comment below and I will answer the question. Thank you very much for listening.